morning, everyone. Welcome to February's Health Education webinar. I hope you're all doing well and that you're excited for this morning. We have a variety of topics today, from public health, behavioral health, as well as some special guests. So we'll dive right into the agenda. If you were with us last month, we met some emergency department physicians from UCSF and SF General. They've returned to educate and reassure our community about the COVID-19 vaccines. Next, Carissa, our public health director, will provide a further update on COVID-19 resources and best practices. After that, we'll have one of our community members, Nanay Mira, join us for a testimony about her COVID-19 vaccine experience. Following that, our guest physicians will run a question and answer panel about COVID-19. These will be questions that you, our community, have asked this past month about the vaccines and etc. Next, public health will provide education on health insurance, and behavioral health will present on understanding mental health conditions. We wanted you to know that pre-recorded presentations are also available in Filipino and Tagalog. So if you'd like to access that, you can head over to our videos and they should be uploaded shortly. And we wanted to give a special shout out to MHC's Tagalog team for making this health education accessible. If you would like to join our current focus group, which is live here, please message one of us or comment on our video, and one of our representatives will message you a link to join us right now. So some quick tutorials before we move on. I'm sure a lot of you are experts at this already, but if you want to answer any comments or questions for our presenters here, you can type your question and hit enter on your keyboard if you're watching from a laptop or desktop. If you're watching from your smartphone, you can go ahead and answer your question here and then tap that blue button you see. We'll also be using QR codes for our surveys. So if you see a QR code and want to fill out our survey, just go ahead and point your phone at that QR code and the link should come up. Also, we ask that you please share this stream. If you like and share this Facebook live stream, that gets our community viewers one raffle entry. And also, if you fill out our feedback survey, you'll have another entry for a raffle. Or you'll have, yeah, you can choose either one and you'll get an entry for a raffle. So without further ado, we're going to get started with our presentations, starting with our guest physicians. So let's all give a warm welcome to Dr. Tomas Diaz, Dr. Mickey Gonzalez, and Dr. J.L. Santamarina.
Hi, everyone. Thank you for having us in this space. We are physicians, and we're here to not make any decisions for anyone, but provide information, the most up-to-date information regarding the vaccine. So my name is Tomas Diaz. I am one of the supervising doctors at UCSF, and I'll pass to JL.
Magandang umaga po sa inyo lahat. Ako po si Dr. Santamarina. Isa po ako sa mga residente sa Department of Emergency Medicine ng UCSF at San Francisco General. So salamat po sa pag-imbita sa amin dito at bigyan niyo kami ng taon para makausap kayo tungkol dito sa COVID-19. And then I'll pass it on to Mickey now.
Hi there, I'm Dr. Mickey Gonzalez, and I'm a first-year resident at SF General and UCSF, and I'm so happy to be here with you guys today.
Okay, and I'm going to take us through some quick information just so we all get on the same page regarding the vaccine. So some important facts. There are two vaccines that are currently available in the United States, the Pfizer vaccine and the Moderna vaccine. You may have heard of the Johnson & Johnson or the AstraZeneca. Those two vaccines are not currently approved in the United States, but hopefully will be soon. So the Pfizer and Moderna vaccines are very similar to each other. They're made the same way, and I'll go through that in a little bit. And both are very highly effective in preventing serious cases of COVID, and both require 2 shots. So the Pfizer vaccine, you get your first shot, and then you need to wait at least 3 weeks before you get your second shot. The Moderna, you get your first shot, and then you need to wait at least 4 weeks before you get your second shot. And the Moderna vaccine doesn't need to be stored at as cold of temperatures, so it's a little bit easier to transport to different parts of the country. How these vaccines work. So on the left, you can see the coronavirus. And what the vaccine does is take a little piece, a little code of the virus. And in a lab, what they do is surround that in a layer of fat, and they add some sugar and some salts, and that's it. And that is what is injected into your muscle. And the fat allows the muscle cell to pick it up and then read it out and print it out, and then present it to the rest of your body to say, this is not supposed to be here. And so your immune system then makes antibodies to defend against this code and the virus. How well does the vaccine work? Very well. So over 40,000 people were included in the Pfizer trial. And among people who got the vaccine, out of 21 or almost 22,000 people, there were only 8 cases of people having symptoms of the coronavirus and testing positive. Meanwhile, in the group that did not get the vaccine, there were 162 cases. So that's about 95% effective. For Moderna, it was very similar, 94% effective. So we're considering them about the same. In the short term, most people may have some soreness at the injection site, some redness, especially after the second shot. Some folks are describing things like fatigue or headache or chills and some fever. There have also been cases of allergic reactions. So when you do get your vaccine, you'll be asked to wait 15 minutes just to be monitored to make sure that you don't develop symptoms like shortness of breath or any tongue swelling, things like that. Most people, their symptoms didn't last very long and they were able to go about their regular day. So we know that the vaccine works very well for lots of groups, and that includes older folks, men and women, all adults. It has not been approved yet for children. And then folks from all races and ethnicities were included in the trial. We also know that it's safe for people with chronic medical conditions like high blood pressure, diabetes, and HIV. And as mentioned, there have been allergic reactions, but even folks who have history of allergic reactions to things like penicillin or medications are okay to get this vaccine. Another thing to note, tell your friends the vaccine is free, no insurance is needed. The one slight caveat to that is the US government has agreed to pay for the initial doses of the vaccine. If we need booster shots in the future, that is to be determined. They have not committed to paying for that. And documentation status, insurance status does not matter. It's covered for everybody. Some things that we don't know yet, we don't know whether even after getting the vaccine, you can have an infection without symptoms and potentially pass it to other people. Right now, it's being studied in patients who are pregnant, as well as kids. That being said, it is currently recommended that patients who are pregnant or breastfeeding do get the vaccine. And the other thing we don't know is how long we might be protected from the vaccine or from the virus after getting the vaccine, just because it's so early. So we may ultimately need booster shots. So in terms of making the best decision for you and your community and your families, I think the best way to frame it is, what are the risks of getting the vaccine versus what are the risks of getting the coronavirus itself? Because we know at this point, almost 470,000 people have died from the coronavirus, and others have been hospitalized and had long courses. So this virus is definitely taking a toll on communities, and in particular, the Filipino community has been disproportionately affected. So I think it's important to hold that comparison when you're making your decision for you. Some things that are not going to change after getting the vaccine, until we know more information, we'll still continue to wear masks, wash hands, isolate as much as possible, stay at home, and maintain physical distance of 6 feet. So we have all been vaccinated, and we each have our own independent reasons. But for me, especially in our work in the emergency department, it was very important for me to not only protect myself, seeing patients every day with the coronavirus, but also for me to protect my patients, seeing folks who have medical conditions that weaken their immune system. You know, it was important to me that I do everything I can to protect them. And then also thinking about my family. My 89-year-old grandmother just got her second dose of the Pfizer vaccine yesterday. So I'm very happy about that, so that we can be together soon. JL.
Salamat. Sa akin din po, ganun din. Nagpabakuna ako dahil sa experience ko sa emergency department, yung lahat ng mga tao na may sakit sa coronavirus na nakita ko. Tapos gusto ko rin protektahan yung sarili ko tsaka yung pamilya ko. Lalo na pakita sa mga parents ko tsaka sa mga lolo ko na okay lang magkuha ng vaccine at actually mabuti na magkuha ng vaccine. So, kaya ako ginawa. And Mickey?
And similar to both of them, I also got the vaccine to protect my patients. You know, we see lots of patients with all kinds of health issues, and we also take care of many COVID patients. And so I wanted to make sure that as someone who's seeing all people, I want to protect them from the virus. And also seeing my family, my family members have health conditions like high blood pressure and high cholesterol. And I want to make sure when I see them that I'm also protecting them. I'm looking forward to when my family can also get the vaccine so that they can be protected as well.
So thank you, and we look forward to answering your questions in a bit.
Thank you so much, Dr. Diaz, Dr. Gonzalez, and Dr. Santamarina. That was great. Everyone stay tuned because they have questions that you asked to be answered later today. Next, we're gonna go ahead with my co-public health director, Carissa. She's gonna provide a COVID-19 update.
Hi everyone, good morning. My name is Carissa, and today I will just be giving a little update on where we're at with the COVID-19 vaccine distribution and also some updated recommendations for masking. So currently we're still in phase 1A, so we're focused on vaccinating healthcare workers and long-term care residents. People 65 and over are also being vaccinated right now. In terms of who's next, the next phase is phase 1B, tier 1, and this covers essential workers in education, childcare, emergency services, and food and agriculture. And according to the state public health department, this next tier should start on February 26th, and this may change depending on the availability of the vaccine. So recently, San Francisco has started using these mass vaccination sites where they're vaccinating, where they're hoping to vaccinate thousands of people per day. In terms of who's eligible, if you're a healthcare worker or you're 65 and older, you should be able to schedule an appointment. Like Dr. Diaz said, the vaccines are free, and you do not need insurance to book an appointment. So one of the vaccination sites that is open is the Moscone Center South, and this is in the Soma district. Healthcare workers and people 65 and over can book an appointment. This is a walkthrough site that's open 7 days a week, and this is the address. If you want to book an appointment, you can head on over to this website listed here, myturn.ca.gov, or you can call this phone number to schedule an appointment. If there's no availability, don't worry, just go ahead and keep checking. New appointments will become available every day, and these appointments will be booked 3 days in advance. Another vaccination site is at San Francisco State University. Right now, this is for people 75 and older. And this is open Wednesdays and Thursdays during the month of February. And if you want to schedule an appointment, you can go to mhealthsystem.com/SafewayCovidSF. Another vaccination site is City College, and this is actually a drive-through site. So it's a little different from the other two, and this is for people 65 and older. And you can schedule an appointment online at this website, and new appointments are posted regularly. All of these links will be provided in the description of this video, and also later I will have a little QR code where you can scan, and all of the links will be available there. So if you are 65 and older, you also will be able to schedule an appointment through your healthcare provider. So if you are a patient at Kaiser, you don't have to contact them first. They will contact you when a vaccine is available and when you are eligible. If you have Sutter Health, they're currently only vaccinating 75 and older, but should be vaccinating 65 and older soon. If you want to schedule an appointment, you can book online at My Health Online, or you can call this number to schedule. If you are a UCSF patient, when you are eligible for a vaccine, you should receive an invitation through MyChart. You do not need to contact them first. So here is a QR code. If you go ahead and you want to just scan the screen and a link should pop up, this will have a little menu of all of the links to these different COVID-19 testing sites. And also there will be a link called a list of all COVID-19 vaccine sites in San Francisco. And this is a link to the San Francisco Department of Public Health website, and their website is updated regularly. So if any new vaccination sites become open, it'll be listed on that website. Okay, so once you are fully vaccinated, the CDC has released some new guidelines for fully vaccinated people. So if it has been at least 2 weeks since your second dose, you have received the vaccine within the past 3 months, and you are symptom-free, you do not need to quarantine after being exposed to someone with a suspected or confirmed COVID-19 case. And you also don't need to quarantine after traveling outside the San Francisco Bay Area. And this is, as long as it's been within the past 3 months and you are symptom-free. So you should still try to be safe, continue masking, and continue physical distancing after you receive your vaccine. Okay. And if you have any questions below about questions about how to sign up, go ahead and put that into the comment and we can try to address it at the end of our Q&A session. And all of this material will be online on Facebook after the live stream is over. Okay, so in terms of mask recommendations, just a quick review. We want to choose a mask that has 2 or more layers of washable, breathable fabric. If you have a mask, you want it to completely cover your nose and your mouth and also fit snugly against the sides of your face and there's no gaps. You want to choose a mask that you can still breathe in, and you don't want a mask that has any of these vents. Because if it has a vent, then you'll be able to spread the virus if you are sick. Recently, the CDC has released a new recommendation to wear a tightly fitted mask, or you can double mask to increase protection. They found that exposure to the virus can be decreased by over 95% if you double mask, so wearing a surgical mask and then a cloth mask over top, or if you wear a surgical mask with this knotted and tucked in sides, as you see here. Basically, this is just to improve the fit of the mask. And so if there are particles in the air that are containing virus, it won't be able to go into your mask as easily. And we can post a video tutorial about how to do this nodding and tucking in. And this nodding and tucking in method works best for people with smaller faces. If you do have a larger face, this nodding and tucking method does change the shape of the mask, and so it may not be able to fit completely over your face anymore. So that's just something to keep in mind. And if you don't have a surgical mask, you can also wear a 2-layer mask with a filter inside to increase protection. And then this is just a picture to show what a tightly woven mask looks like versus a loosely woven mask. If you are choosing a cloth mask, you want to choose something that's made out of a tightly woven fabric so that there are not a lot of holes in between the threads of the fabric. Okay. And then lastly, if you choose to double mask with an N95, you want to put the N95 first and then the surgical mask on top of that. The surgical mask can help to further better the fit of the N95 and also to help prolong the life of the N95 mask so you can reuse it multiple times. And if you have any questions, go ahead and put it down below. And now we will transition to the Q&A portion of our live stream.
Thank you, Carissa, for your a great presentation, very informative. Before we go into the Q&A, we're actually going to go ahead and do a quick interview with one of our community members, Ms. Elmira Lagundi. Ms. Elmira has been a part of the SOMA community, and she's been very active in helping people on their Zoom, getting them access to these webinars, and also helping translate for a lot of our community programs. So she's actually the 3rd person to be vaccinated at the Moscone Center. And so she's here today to talk to us about her experience. Elmira, do you want to talk about a little bit about, just to introduce yourself, please?
Okay. Magandang umaga sa inyong lahat. Ako si Elmira Lagundi. Ako ang unang pangatlo ko sa taong nakakuha ng vaccine sa Moscone Center. Nung una, I'm not very eager to get the vaccine because para sa akin, para yan sa mga frontliners at saka sa mga ibang mga tao na may trabaho na nawalan dahil sa COVID. So kailangan nila ng protection. Pero noong February 2nd, nakita ko sa aming, nag-email ang Kaiser sa akin na para lang sa mga 65 and above yung pwedeng mabigyan ng injection. So nag-email ako sa akin doktor, tinanong ko, sabi ko sa kanila, I'm 76 years old, so I'm eligible to be vaccinated. So sumagot ng doktor ko, sabi niya, okay, I will let you know. So ang akala ko, mga 1 week pa. Tapos nung hapon, tinawagan niya ako. Sabi niya, pero hindi ko nakuha. Nag-iwan siya ng message na I can go and have an appointment. So nung mga 5:30, may tumawag sa akin from Kaiser. Sabi sa akin, are you willing to go to Moscone at 11 o'clock tomorrow morning? It's a Thursday morning. So I said, okay. Hindi na ako nag-isip-isip. Just said, okay. And then sabi nila sa akin, are you willing to be picture taking with you? I said, okay, I'm okay. And so nung February 4, I went to Moscone Center. Doon nila ako pinadaan sa stop entrance. Tapos sabi sa akin nung dito may pangalan, ang pangalan ko nandoon nakalista. So pinapasok nila ako, nagtaka ako, sabi ko, bakit maraming tao na doon, tapos may mga silya, tapos may mga microphone. Sabi ko, mukhang merong program dito. So doon kami pinatawid kami doon. Doon kami pinaupo sa side na may nakalagay doon mga reserved seat. So doon ako sa number 3 seat pinaupo nila. So nanood kami, nagsalita si Mayor London Bridge, saka yung mga ibang mga doktor ng, I think doktor ng Kaiser at ng iba-iba pang organization. Tapos pagkatapos noon, may question and answer. Pagkatapos nung kinuha na kami ng nurse, isa-isa kami pinapunta doon sa vaccination site. So nung pinaksination nila, nakita ko maraming mga camera. Sabi ko, wow, ano to? Tapos nung pagkatapos nun, nag-thumbs up akong ganyan. Tapos pinabalik ako sa upuan. Ang sabi nila, wait for 15 minutes. You might have a reaction. So nanood kami doon. No-offer nila kami ng tubig. Tapos after 15 minutes, sabi sa akin, okay, you're done. So I have no reaction. So sabi nila, how do you come here? I sabi ko sa kanila, I took the bus. So now you're not going to take the bus. We're going to get an Uber for you to bring you home. So I was the lucky one to be vaccinated without all those questions asked. Nobody asked me to fill a paper. So I was lucky na kasi ngayon nakita ko yung marami akong mga kaibigan na gusto magpa-vaccine pero they cannot get it. They have to go online. So I'm lucky. Ang sabi nga sa akin nung aking yung aking musical director ng Bernal Heights Community Music Center, ang sabi niya sa akin, wow, the next day nung Friday, nag-email siya sa aming lahat ng aming mga member ng Bernal Heights Community Center, Bernal Heights Choir. Ang sabi niya, look who I found in the newspaper, our very own Mira. You're lucky. Said they chose you to represent everybody because you are, first of all, you are a senior. You represented the seniors. You're a woman. You represented the woman. You're a people of color. You represented the people of color. You're an Asian. You represented the Asian. You're a Filipina. You represented the Filipinos. So that's all. I was lucky. Thank you.
Thank you, Night. Yan. Can you put up your camera po para makita namin yung inyong beautiful face? Yan, para makita ng ating audience. Yan. Thank you, Elmira. Yeah, so for our audience members, we just want to let you know that Nanay Elmira was lucky to have, all of the cameras and Mayor London Breed, but just to let you know that that's not always the case, especially when you get vaccinated at the Moscone Center. It's just because it was the parang opening lang po yun. So sinuwerte si Nanay Elmira na nakapunta siya doon para alam lang ng ating mga community members. Okay, so Nanay Elmira, thank you po for sharing your experience, and we just had a few other questions for you. So when you first took the vaccine, did you always think that it was safe or important to get the vaccine?
No, kasi bago pa lang, so in doubt pa ako. So sabi ko, I'll just wait.
Yeah, what kind of helped you change your mind po? Ano yung nagpa-convince sa inyo?
I got a message from Messenger. Somebody sent me about a message of I think it's Father Nicanor Austriaco. In-explain niya yung ethical and scientific issues about COVID vaccination. So ang magaling ang kanyang pagkaka-explain. So na-convince ako. Sabi ko, I think I needed one. Because kung naghintay pa ako, baka kung hindi ko in-accept yung offer sa akin, baka ngayon maghahanap pa ako kung saan ako magpapabaksin. So I was lucky.
Oh, okay. Yeah, so for our audience members po, what we'll do is kukunin namin yung link na yon from Nanay Elmira, and then lalagay po namin sa chat para mapanood ninyo. So I think the video is from their priests in the Philippines, so you can get more information. Pero just be aware po na some of the information only is applicable to the Philippines. Halimbawa, yung vaccine doon ay hindi pa libre, pero dito sa United States ay libre na. Pero they provide a lot of insight about yung mga ethical concerns ng vaccine. Kung gusto niyo yun mapanood, galing sa ating mga pare sa Pilipinas. Okay? That's my last question po. So you mentioned na minonitor nga kayo ng mga doktor in case you had allergic reaction to the vaccine. Good thing wala naman po. After ng inyong pag-vaccine, naka-feel po ba kayo ng ibang side effects?
No, nung first day, parang sore lang dito sa injection site. Pero nitong maybe 2 days ago, I feel like I'm sleepy. That's all.
Yeah,
Pero okay
yeah.
naman. Wala
Thank you.
namang side effect.
Thank you po, Nanay Almira. Yeah, so the side effects may vary from person to person, but for Nanay Almira, she was also lucky because she didn't get as too many side effects as she mentioned. Okay, Nay, before we end po, do you have any last advice for any of our community members that are watching today?
Yeah, lahat tayo kailangang magpabaksin para matapos na itong mga takot natin na magkaroon ng COVID-19 at alis na yung mga namamatay na para makatulong tayo hindi na tayo matatakot na lumabas dahil makakakuha tayo ng COVID-19. So, kailangan natin magkaisa na magpabaksin tayong lahat.
Yeah, thank you po, Nanay Almira. So for everyone, we want to make sure that we have all of the different perspectives from the doctors, from students, and from community members to help you make the best informed decision about whether or not you want to get or you should get the vaccine. So we now want to move on to the question and answer portion. Thank you, Nanay Almira, for joining us today. And so with the question and answer, you can put any questions that you might have on the Facebook chat. And we will first begin with some of the questions that were sent to us prior. And this will be facilitated by our public health team.
Okay. So the first question is, how long until a person who is infected with COVID will be non-contagious? Is 10 days enough to clear the virus?
I can't get my video back on, but this is Dr. Gonzalez, and I want to let you guys know that after being infected with the COVID virus, you no longer need to isolate if it's been 10 days since you first had symptoms, and if you've not had any fevers for 24 hours or more without using any medication to help reduce your fever. And as long as your symptoms, your COVID symptoms like shortness of breath or cough are improving, that's also a time that you may not need to isolate. The other thing is some folks who get the COVID virus may no longer be contagious, but they may still have some side effects like shortness of breath and fatigue for months after actually the infectious period, but those folks are not contagious.
Okay, great. Thank you. The next question.
I forgot the last question about if you got COVID in the past month, is the vaccine still effective? And we are recommending that even if you've had COVID, the virus, that you should get the vaccine, or we recommend getting the vaccine as long as it's been 10 days and you finished your self-isolation. The vaccine will be effective for you unless you received IV antibody treatment in the hospital. The only thing is right now, we don't know how long the vaccine will provide protection, but our hope is that it's going to be longer than if you acquired the virus and got sick, and your body will also produce antibodies to the virus itself. But we're thinking that the vaccine is actually going to provide longer protection against COVID infections in the future, because there have been cases where people have gotten COVID for a second time.
Great, thank you. The next question is, does the COVID-19 vaccine protect against the new variants?
Hi, this is Dr. Santamarina again. So unfortunately, we still need more time and information to fully answer this question. But so far, it seems that the Pfizer and Moderna vaccines will protect against the UK variant. but don't work as well against the South Africa variant. This just means that maybe in the future we're going to require booster shots, but the pharmaceutical companies are already working on incorporating these variants into their vaccines. So like Nanay Elmira said earlier, what this really means is that we need to try to get everyone, enough people vaccinated as soon as possible. And this will help us so that the virus does not get time to develop enough mutations to get around our current vaccines. And hopefully if the other vaccines like the AstraZeneca and Johnson & Johnson's will be approved, we'll be able to get more people vaccinated more quickly.
Okay, great. Thank you. The next question is, why doesn't my provider have the vaccine for us?
I can take these two questions, and I think that Carissa actually did a wonderful job already answering the second question. But for the first question, right now the supply is low and is not able to meet the demand, and that's why even if you are in an eligible group, you may have difficulty scheduling an appointment. And that is something that the Biden administration is working on. Dr. Fauci just said actually a couple of days ago that the hope is that things are really ramping up in terms of making the vaccines. So definitely by April and hopefully in March, we'll have a lot more doses available to start giving the vaccines out in many more doses per day. The other thing, as mentioned, is that hopefully with the other vaccines like the AstraZeneca and Johnson & Johnson, if those are approved, then we can vaccinate even more people more quickly.
Okay, great. The next question is, for people with complicated past medical history, including those that have allergies to antibiotics and those that have gone through procedures due to life-threatening diagnoses like cancer and are taking medication, will the vaccine cause further complications?
This is an excellent question and also super important. What we want you guys to know is that it's safe for anyone, even with chronic illnesses or histories of cancer or who've received chemotherapy or radiation, that they can get the vaccine. It will not interfere with any medications. And for patients who are currently on these therapies that weaken their immune system, like chemotherapy for cancer or medication for lupus, it's still safe to get the vaccine. However, because our immune system is weakened, you may not have as strong as a response to the vaccine and build up as many antibodies, but the vaccine should still provide some protection, and that's important. This protection is better than no protection, especially given that these folks already have weakened immune systems, and so they're at higher risks of getting COVID and getting very sick. So we really want to protect those folks.
Okay, great. And then after getting the vaccine, is it good or bad to experience side effects?
I can take this one. So I think it depends. To me, it felt like a good thing just because I knew that my immune system was working and that I was building up the antibodies. But I think I would say overall, I think it's a good thing. But if you do not experience any side effects, that is also fine. Your body still should be making the antibodies. And like we said earlier, usually these symptoms will only last a day or two, and you can continue to go about your day. They shouldn't be so severe that you're, stuck in bed all day or anything like that. And then for this second question, in terms of transmitting COVID after vaccination, the short answer is we don't know, because that was not studied in the initial trials. And so that's why the recommendations are, even after you get the vaccine, to continue wearing a mask and maintaining distance. That being said, we're starting to get that information, and it looks like the transmission goes down by a lot after you get vaccinated. So, hopefully soon, but we'll know for sure, and we'll be able to sort of interact more like we did before COVID. But for now, we'll have to wait until we get the okay from the CDC and health officials.
Okay, thank you. And then we also have some questions from the audience. The first question is the Pfizer vaccine as effective as the Moderna or AstraZeneca vaccines?
I can answer this one. So as Dr. Diaz had mentioned earlier, the Pfizer vaccine is around 95% effective after getting a second shot. And the Moderna, we're going to say, is pretty comparable, maybe around 94%, but almost equal. The Johnson & Johnson is about 76%. And Dr. Diaz can correct me on this one, but I believe the AstraZeneca is about 63%. The advantage of the Johnson & Johnson is that you'd only need one shot. Yeah, and if you need me to repeat this in Tagalog, just let me know, okay?
Okay, great. And then the next question is, what are the best ways to manage the side effects of the vaccine? I know I saw one place say that we shouldn't be taking pain relievers.
I can take this question. So we don't recommend people taking pain relievers before. So like Tylenol and Advil, we say, take those after you've had symptoms, after you've received the vaccine. And so just like any other, since the symptoms are kind of similar to any viral illness, like a cold, you might feel kind of achy, you might feel tired. I think just like those moments when you're sick, it's good to take care of yourself, rest, drink lots of fluids, and take Tylenol or Advil as needed to help kind of reduce some of those symptoms. And in a few days, you should feel kind of back to your normal self. But it's okay to rest and take good care of yourself during that time as well.
The one thing I'll just add to that is you shouldn't take those things before the vaccine to try to avoid symptoms, because you do want to have the immune response.
Okay, thank you. The next one is the COVID vaccine, I know you touched on this a little bit, but is the COVID vaccine safe for people who've had a bad allergic reaction to the flu vaccine? This person has a friend who had asthma and allergies to different foods, and that person had developed meningitis from the flu vaccine.
So I can take this, and yes, so the COVID vaccine is safe for people who have had a history of bad allergic reactions, including people who need an EpiPen. If you carry around an EpiPen, you're still okay to get the COVID vaccine. Specifically for the flu vaccine, what causes severe allergies is usually related to egg, because the flu vaccine is actually made in like chicken yolks. But this vaccine, like I said, is really just the code for the virus, the layer of fat, some sugar, and some salts. And so the only allergy that is that we tell people that they should not get the COVID vaccine is a very rare allergy to what's called polyethylene glycol, which is it's in that fat layer. It's also called PEG or PEG. It's a very rare thing. And so you probably wouldn't know if you have that allergy. But having those other allergies doesn't mean that you're more likely to have this allergy. And that's why they've built in the 15-minute window to watch people. Because if you do have an allergic reaction, we know how to treat that. And there have been no deaths. There have been people who have had severe allergic reactions, but none of them have died. We've been able to treat them, and they've been able to, return home and live their lives.
Okay, thank you. That's good to know. And the next question actually from Nana Elmira is it true that getting the side effects makes us build more immunity?
I can take that since it was sort of related. I think that regardless of whether you're having side effects or not, you can assume safely, you can think that you are protected, but there's no way of knowing, and they've studied this not with this vaccine, but with other vaccines, that having more side effects doesn't mean you're more protected. Just different people's bodies react a little bit differently. But if you get the vaccine, like we've been saying, the Moderna and Pfizer, you're 94 or 95% protected from severe COVID symptoms, regardless of whether you experience side effects or not.
Okay, great. Thank you. And then another question is, what is a booster shot? Should I expect similar side effects from a booster shot that are known in the original vaccine?
I can take this one too. So a booster shot is, sometimes they rework the vaccine in order to address some changes and mutations that happen. So viruses naturally make mutations as time passes. And that's why, like for the flu shot, we need to get a dose every year. They sort of reconfigure and readjust all of the what's included in the vaccine. And so the same may be true for COVID to account for different variants and different mutations that the virus ultimately makes. During a pandemic, like we're in right now, those mutations happen very, very quickly. And that's why we're seeing all of these variants happen and come about in what seems like a short amount of time. But once we get down to more calm levels of the virus, those mutations should happen much more slowly. So what we're hoping is that even though we're seeing a lot of variants right now, and we may need a booster, say within the next 5 years, hopefully once the cases are down, hopefully the protection will last much longer and we won't need boosters as frequently.
Okay, so itatranslate ko lang to sa Tagalog. So basically po, yung booster shot, kasi binibigyan tayo ng vaccine. Tapos yung virus, paminsan, katulad ng mga variant, nag-iiba ng parang yung contents ng virus. So yung booster shot, ang ginagawa nun is para to change a little bit yung yung contents ng vaccine para ma-address yung mga different variant na magdarating. So katulad nung yung flu vaccine na binibigay sa atin every year, ang ginagawa niyan is para to address yung mga nag-iibang variants ng flu. So ang balak natin is katulad niyan sa COVID vaccine. Pero ang hope naman natin is that ngayon maraming mga variant na nag-appear dahil hindi pa masyadong contained yung coronavirus. So ang balak natin is hopefully once a lot of people are vaccinated na, edi mas mabagal na ang pagkakagawa ng virus ng mga iba-ibang variant. So maybe in the future, mga every 5 years lang tayo magkukuha ng booster para dito sa coronavirus vaccine.
Okay, thank you so much. That looks like that is the end of our questions. Thank you so much, doctors, for coming in today and answering our questions. I know that we appreciate it and that you have definitely alleviated some of our concerns about the vaccine. So thank you so much for your time.
Thank you for having us in this space.
Maraming salamat.
Thank you.
Like Carissa said, thank you again, Dr. Diaz, Dr. Gonzalez, and Dr. Santamarina for providing your expertise and addressing the specific questions from our community. And I know to our audience that was a lot of information, so we're just going to take a quick pause right now. This is a good time to take a bio break. Perhaps you need to use the bathroom or get a glass of water. But in the meantime, I will guide those who want to participate through a short breathing exercise. And what we're going to do is close our eyes and take 3 deep breaths. We'll be inhaling through our nose and exhaling through our mouth. And I'll let you know when to open your eyes. So I'll go ahead and start. Just go ahead and make sure you're seated in a comfortable position, or whatever position you're in. Just make sure you're relaxed and comfortable. I'll be seated, hands on my lap. So you can go ahead and close your eyes. You can take a breath in. Deep breath out. Take another breath in. And breathe out. Try to relax more this time. Take another breath in. And breathe out. You can resume your normal breathing, but just keep your eyes closed. Take these next couple seconds to just recognize where you are right now. Check in with how you're feeling. You can go ahead and open your eyes when you're ready. So thank you to everyone who participated in the exercise. Hopefully that got to ground us together, even in this virtual space. So we're going to go ahead and move on to our next presentation from Public Health. They're going to break down health insurance for us. So the floor is yours, Public Health.
Thank you, Julianne. Hi, everyone. My name's Sam, and joining me today would be Darius, Katie, and Sean, and we're going to be talking about health insurance, particularly really like jargony words. We're going to try to break that down for you. Medicare and Medicaid, which are some programs that you might be eligible for. So the objectives of this presentation is to really understand what health insurance is, maybe like why we need it or like why it's important to know about it, the differences between what an HMO plan is and a PPO, what it means to have a premium or what it means to have out-of-pocket expenses. Also, again, Medicare eligibility, how to enroll, and then what coverage looks like once you get it. And also Medicaid eligibility, enrollment, and what coverage looks like when you get it.
So just as a disclaimer, there'll be a lot of info on the upcoming slides, so please feel free to not keep up. We do not have much time to go over all the details, so what we may say will not cover everything on the slides, and we'll make sure to share these slides afterward.
Hey everyone. So what is health insurance? Health insurance or healthcare in the US can be very expensive, whether you need to go to the doctor, get surgeries, get medications or equipment. And so health insurance is a way to help you pay for some of that. And so what happens is you pay a health insurance company a monthly or annual amount of money, and this is called the premium. You may have heard this before. In exchange, the health insurance company will help you pay a certain amount of money when you need healthcare services or equipment or such. And how much they pay will really depend on the plan that you have. And so here are some common health insurance types of plans that you may have heard of. HMO, a really common example of that would be Kaiser. And so the way that works is it tends to be cheaper in terms of how much you pay monthly or annually. And in exchange, you have a little bit less flexibility. So whenever you need any kind of medical care, you first see your primary care physician. And then if you need to see somebody else, like a cardiologist, for example, the primary care physician will send you a referral or send a referral to see somebody else. And you can only visit providers that are in the network, and they won't pay for healthcare outside of the network unless it's an emergency. On the other end of the scale, we have PPO plans, which are a lot more flexible, but they're more expensive. And so you don't need to see your primary care physician. You can schedule on your own whoever you want to see. And they will also cover doctors that are not in the network. It just might cost a little bit more. Next slide, please. And so we're going to go over some examples to teach you some of the terms that you may have heard of before, using Sally as an example, who has health insurance. But I mean, this could be your mom, your uncle, your brother, your sister, really anybody. Okay, so on this slide, we'll cover what happens when, for example, your uncle gets sick. So say your uncle gets injured, nothing emergency related, but maybe he feels not well, and so he wants to go to the doctor a few days later. So when you go to the doctor, you pay maybe like $20 for the visit. This is called the copay. It's an amount that you pay every time you get some kind of service. Now, maybe you go to the doctor for a while and then they decide that you need an x-ray to see what else is happening. And so if you haven't met your deductible, then you may have to pay for everything. Now, if you have met your deductible, you may only pay a small percentage of that cost, maybe 20%. So if the x-ray costs $100, then you pay $20. So the deductible is the amount of money that you have to pay before the health insurance will start helping you. And the co-insurance is the percentage that you pay for things. And again, these all depend on your health plan. Now, maybe you get an x-ray and then they figure out that you need to get a surgery, for example. So if you met your out-of-pocket maximum for the year through anything that you've paid for so far, then you won't have to pay for anything else. So if you met your out-of-pocket maximum for the year and you need a surgery, for example, then the health insurance will pay for 100% of covered services. Next slide, please. So another common plan is called a high deductible health plan. This is a type of plan which has much lower premium, so you pay a lot less per month or per year, but it requires you to pay more for out-of-pocket costs. And so this plan generally works better for people who are younger or healthier. It's just basically people who don't need to get a lot of healthcare services, and so they can get away with just paying less money every month or every year.
Alrighty, so now I'll go over Medicare. So Medicare works just like regular health insurance. However, you do need to pay premiums, deductibles, and copays. Medicare is a federal health insurance program for people over 65, younger people with disabilities, people with end-stage renal disease, and you must be a U.S. citizen or permanent resident who has lived in the U.S. for 5 consecutive years. Okay, so there's 4 parts of Medicare, and for Part A, most people don't need to pay a premium if the patient or their spouse has paid enough Medicare taxes during their career. For Part B, everyone pays a premium of $144.60. And for Part D, you must purchase a separate plan to cover prescription drugs. So each plan has a different premium and copay.
So to go over a little more of what the Medicare covers, for Medicare Part A, this is original Medicare consists of Part A and B. So you don't need to go to your primary care to get a referral from your visited specialist. For Part A, this is the hospital insurance, and this covers inpatient hospital visits and nursing care and many things like that. And for the next one, original Medicare Part B, Part B is the medical insurance, and this covers medically necessary services like ambulance services and medical equipment, or preventative care, like when you visit your primary care provider, or mental health care. Original Medicare's Parts A and B do not cover many things like dental, eye care, and hearing aids though. And the last part is Part D. So Part D must be bought separately from the original Medicare. So this is the one that covers many prescription drug insurance plans, including like insulin, high blood pressure medication, and all or almost all drugs in these 6 categories of antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and anti-cancer. So each Part D plan will have its own list of covered drugs that you can ask your insurance about. And for the last part, Part C, so this is A plus B plus D. So this is known as Medicare Advantage, and this covers all services and needs. This must also include Part D, and this includes the vision, dental, hearing, and wellness care. So Medicare Advantage plans are like HMO, in which it's generally cheaper also.
Okay, so here are some ways that you could enroll in and apply for Medicare. Either just on the Social Security website listed right here, or you could call that phone number 1-800-64227.
And for the enrollment period in Medicare, there are 3 periods in which you want to enroll, which you can enroll. The first one is the initial enrollment period. So this is the 7-month period that includes 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So you really want to make sure you enroll in those 3 months before your 65th birthday, because then your coverage will start right when you turn 65. Otherwise, if you enroll right when you turn 65 or a little bit afterward, you'll have to wait 1 to 3 months to enroll until you get coverage. The second one is the special enrollment period. And with this one, you can enroll anytime as long as you, your spouse, or family member, if you're disabled, are working under an employer that provides the insurance. And the last one is the general enrollment period. So this starts between January 1st and ends March 31st. And your coverage will start in July. But with this one, you usually have to pay a late enrollment period penalty. So you really want to enroll in those first 2 periods. And also just another note is that if you qualify for Medicare, the fee to apply is $599 to process each enrollment application as of January 2021. And also, if you delay the application, the fee becomes more expensive every year after you turn 65, you're not enrolled. So you really want to aim for those 3 months before you turn 65.
So now I will be talking about Medicaid, which is another program that's available. And Medicaid in California is actually just called Medi-Cal. And so if you hear Medi-Cal, just know that it's Medicaid. So what exactly is Medicaid? Medicaid is a federal and state program that helps with medical costs for some people with limited income and resources. I'm going to delve into like what that means in the next slide. So for Medicaid, how you have to be, or like what makes you eligible is that you have to be a resident of the state of California, a US national, a citizen, a permanent resident, or a legal alien. And so then after that, after you meet that requirement, you have to fit in one of these qualifications on the next 3 slides. So one of the qualifications that you can enroll one of the qualifications that you can have is based on your income. And so what exactly does it mean to be low income? Well, for example, if you were in a house of 1, you would have to be making below $16,395. And so it really just depends on what the household income is and how many people are in your household. So that's what it means to like be low income for Medicaid eligibility. One of the other things that you could qualify for Medi-Cal for is based on any programs that you might be in. So for example, if you're in CalFresh, then you could apply for Medi-Cal and see if you're eligible that way. Or lastly, one of the other possible qualifications to enroll in Medicaid or to get Medicaid insurance is these things. So 65 and older, blind, disabled, under 21, pregnant, residents in skilled nursing or immediate care homes, people with refugee status for a limited time, parents or caretakers of disadvantaged children under 21, and people who are diagnosed with breast or cervical cancer. So things that Medicaid covers once you get it is things like preventative screenings, mental health services, physical therapy, prescription drugs, dental care, home support, long-term nursing home care, optometry services, substance use treatment facilities, pediatric early period screening, diagnosis, and treatment. And so something about Medicaid is that it usually offers really cheap insurance. Sometimes the premium is like $1 per month, and it really just depends. And then there are multiple ways in which you can enroll in Medicaid, but the one that I've provided here is that you can apply to Medicaid through this website called Covered California, and your services are available in Tagalog, and you can also call a number listed right here on the screen if you need assistance on it. And right here is just kind of a screenshot of what the website looks like. Now I'll be kind of going over what open enrollment means and like what the website looks like and how to enroll. Something really cool about Medicaid is that you don't have to be there's no time span in which you have to enroll in it. You can enroll in any time. And if you want to discontinue your insurance and maybe see if you apply for or like are eligible for Medicaid and can get it, then you can also do that. Again, there's no timestamp on it. So this is what Cover California looks like. You're going to go to the Can I Get Financial Help area, and then you'll press continue. And then after that, they're going to ask you a question based on your household size. And then you can say yes, or you can say, no, I make more than that. If you click onto yes, though, they'll have you in this area where it says, how do I apply? And it'll tell you exactly how to apply right here. Again, you can apply online or with in-person help for free with an agent or through the phone. And it usually takes about 45 minutes to apply to it. And then once you apply, if you choose online, you just click here, this and that, and then it'll give you all the options. So yeah, that's basically it. After that, it'll just ask you all the other questions that you need for enrollment. And now we'll be going to the summary of this.
Alrighty, so I know that was a lot of information. So yeah, we made a brief overview right here comparing Medicaid versus Medicare. So basically Medicaid coverage varies state to state, while Medicare coverage is consistent nationwide. Medicaid is a federally and state funded program, while Medicare is just a federally funded program. Medicaid is mostly free. However, there are a few small charges, and for Medicare, there are annual deductibles and co-insurance. Lastly, Medicaid mainly targets folks with disabilities, low-income populations, and pregnant women, while Medicare is mainly for people over 65 and people with disabilities. And lastly, again, just to note, Medicaid is called Medi-Cal in California.
Just as a reminder, we'll make sure to share these slides afterwards. So here's some links that you can look at for more information about Medicare, Medicaid, market to shop for health insurance, how to enroll in Medicare Advantage, and a phone number if you need help over the phone and with a live person.
And here are just some slides on resources for children. And so there's something kind of like Medicaid, but it's specifically for children, and it's called SCHIP. And so if you wanted to apply for your child, or if you know someone who wants this, feel free to get this. And write down this number or this website. And again, we'll be sharing these slides and these resources afterwards. Another thing is the Kaiser Permanente Community Healthcare Program. And so if you don't qualify for SCHIP, this is another way to get some assistance in paying for health insurance. And then here are just some local resources. And so Health San Francisco is a program to make healthcare services available to uninsured San Francisco residents. And that's regardless of your immigration status, employment status, or any pre-existing conditions. And essentially what pre-existing conditions means is just having health conditions before you even apply to like these services. And then we've also given a comprehensive list of 25 clinics that are available across San Francisco for free or low-cost healthcare services.
All right, thank you everyone for tuning in and listening to our presentation on insurance. The presentation slides, as well as other helpful, will actually be linked on our Linktree website, which is linktree/MHC_PH if you want access to it again or need other references. Again, thank you so much for taking time to be here today.
Thank you so much, Public Health. That was awesome. You really demystified health insurance. I know that was a huge topic to tackle. Now we're going to move on to our behavioral health chairs, and they're going to be presenting about understanding mental health conditions. So take it away, Gabe and AC.
Hi, everybody. My name is AC Starr-Tellington.
My name is Gabriel Sumayan Garcia.
And we are presenting on behalf of the BH Committee, where we are going to be talking about understanding mental health conditions. Okey-dokey. Let's go ahead and move on to the next slide.
So for today's discussion, we will be talking about mental health and mental health conditions and how they relate to us. Then we will talk about stigma surrounding mental health conditions with an accompanying activity about JR's story. But first, AC will introduce to us what mental health is.
Cool. So before we understand mental health conditions, we have to understand mental health. What is mental health? So mental health is our emotional, psychological, and social well-being. It affects how we think, feel, and act, and it helps how we determine and handle stress, relate to others, and make choices, and it is incredibly important all throughout our life. Mental health is an integral and essential component of health, and just because we can't physically see its effects does not mean that its importance should be brushed under the rug. Indeed, there's no health without mental health, so it's important to find a balance within our own physical and mental well-being. Now that we understand what mental health is, let's get on to what is a mental health condition. So a mental health condition or conditions is a condition or conditions that affect the person's thinking, feeling, behavior, or mood. It can impact day-to-day living and may also affect our ability to relate to others. But throughout this, if you do have a mental health condition, remember, 1, you are not alone, and 2, mental health conditions are a lot more common than you may think. Likewise, mental health conditions can have several linking causes. It is not a singular pathway. It can be caused by multiple experiences and factors. It can relate to our very own identities as Filipino and Filipino Americans. Likewise, how much money we make can take a part in it, working conditions that we are in, and our status as an immigrant. It can be genetic, so it can be passed down just like a physical illness can. Your environment can also be a factor of it, and lifestyle influence. Like I said before, our identity as brown people can also be cause a mental health condition. I think that we as a people are so work driven and focused on providing for the people that we love that we forget the struggles that we went through culturally as immigrants and our struggles as people of color in general. I believe that Filipinos are so forward focused that we forget to take time for ourselves, which is why it's so important to destigmatize what mental health and mental health conditions mean in our culture and how we are affected by it as Filipino and Filipino Americans specifically. Now, speaking of destigmatization, I'm gonna go ahead and pass it over to Gabe, where he will be talking about mental health stigma.
Hi, everyone. Yeah, I'll be talking about mental health stigma. So before we go into that, I will be defining what mental health stigma is. So what is stigma? For me, I view it as maybe viewing someone differently because of a certain thing about themselves. And so what do you think of mental health and people who have a mental health condition? You know, from experience and growing up with my family and how they saw mental health, I always thought that having a mental health condition is because someone is crazy or nabaliw sila or nasira ulo. This is itself a stigma towards a person because, you know, even feeling sad, which is such a normal feeling that we all have, is marked with the idea that we are crazy or need to be taken care of. Having a mental health condition doesn't mean that we get to assume bad and hurtful things about a person, because mental health conditions can come from so many different things, such as what AC told us earlier. We shouldn't base our perception of a person just because they seem quote unquote different due to a mental health condition. Stigma is not allowing us to fully understand a person. And you know, even pity is a form of stigma because we assume that, again, this person needs help and that we need to save them. To continue our discussion, we wanted to do a little activity with you all to reflect on our own thoughts about this topic and to understand our own perception of stigma, mental health, and mental health conditions. So, you know, I ask you all to self-reflect for a moment and think about the questions that will come up after we present. So me and AC will be reading an anecdote from someone who's been having a hard time. We introduce to you JR, a 40-year-old man. JR is a 40-year-old man who has been sleeping too much and refuses to eat with the family. The family notices that he's always in a bad mood, he never makes his bed, and would always leave the dishes out. He isn't cleaning up for himself, and his family just can't handle how stubborn and lazy he has become.
So, Gabe, do you think that there's something wrong with JR?
Honestly, I think so.
Why did you have these thoughts?
I had these thoughts because, you know, his actions and his behavior are making his family upset, and, you know, he's not really taking care of himself and the living space.
Do you think JR is having problems?
Yes, because I don't believe that Jared's always like this. I don't think this is his personality or this is him. there's something more going on with him, and I really want to understand, like, what's happening to him inside and internally.
Would you talk to JR?
I don't know how and honestly when, but I would try to find a way to talk to him where he's comfortable opening up to me so that I can understand how he's feeling, especially like, if I was one of the people living with him. I really don't want him to always feel like this, and I kind of just want my friend back.
No, yeah, I definitely agree. I would definitely talk to him as well, to make sure that he doesn't feel alone. Little things that I noticed in our statement and in our anecdotes, such as sleeping too much or refusing to eat, are telltale signs of depression and anxiety. So I would definitely check up on him and ensure him that he has a shoulder to lean on for his struggles. So for this presentation, our main purpose was to emphasize the fact that having a mental health condition does not mean that you're broken or that your family did something wrong. Problems with mental health is no one's fault. Recovery, including meaningful roles in social life, school, and work is possible, especially when you start treatment early and play a strong role in your own recovery process. And like we said before, there's multiple linking causes. As I said before, our identities as people of color has a factor in it. But again, there are certain things that we can do to better our mental health and our mental well-being. The picture on one can be talking about our feelings to someone that we care about. Letting some of that steam out and realizing the fact that we are struggling can help us better progress in our mental health. Keeping active and exercising, whether it be by yourself or with people, can definitely make a positive impact on your mental health. Exercising raises our happy chemicals in our brain. So doing that will definitely make us a little bit, keep our mental health stable. Likewise, doing something you love, hobbies, whether it be making music, creating art. I know for me personally, I love planting plants. I'm definitely a big plant mom, and it definitely reduces my stress levels and betters my mental health. And finally, keeping yourself grounded. One way to do that would be meditating, and like keeping you grounded to what you want to do and what you want to progress in. We want to emphasize the fact that, again, like mental health is very important. So it's important, and we only have one life to live. So it's important to take care of ourselves and our physical and mental well-being.
Yeah, and before we end the presentation today, me and AC just wanted to provide some resources just in case today's discussion may have brought up feelings and emotions that you've been feeling, or that's a friend or family member who's going through similar things that maybe JR felt in his anecdote. And salamat po, ingat kayo, at happy Valentine's Day.
Thank you so much, Gabe and AC. That was an awesome presentation, and we appreciate the stories you put into it. So now that wraps up our presentation for today. We asked you to fill out our feedback survey. And again, a survey completion equals 1 raffle entry. The link is tinyurl.com/MHCHealthEdSurvey. And then this is a special QR code for MHC volunteers only. Please just fill that form out right now. I'll leave it on for 10 more seconds. And then I just wanted to give a special thanks to the South of Market Community Action Network for partnering with us. This is all their information there, and just wanted to give a shout out to Ate Elisa for your partnership and for meeting with us and providing us feedback for our health education presentations. So yeah, that wraps up today's webinar. Thanks to everyone who made it happen, including our guests, our physicians, and Nanay Almira. We hope to see you next month, March 13th at 10 a.m. for our next health education presentation. Thank you all for watching, and take care.